Okay, good morning. I'd like to call to order the Public Health and Community Service meeting for August 28th at 8:30 a.m. Could I get a roll call, please?
Hendricks. Krieger. Here. Van Hoff. Sullivan.
Here.
Shorten.
Here.
Altoff.
Here.
Lundberg.
Here. Welcome, everybody. Minutes approval for July 31. Could I get a motion, please?
So moved.
Okay, Ms. Altoff, seconded by Mr. Shorten. All those in favor?
Aye.
Public comment?
Oh, we have none. Last call?
Okay,
All right, tell us.
okay. So, moving on to member comments. I just wanted to mention we've got quite a bit to cover today, and since one of our members will need to leave by 11, I'd appreciate everybody's help in keeping the discussion moving so we can get through the agenda together. Are there any other member comments? Okay. Seeing no more, no new business, routine consent agenda. Is there a motion to approve the one item? All right, Mr. Sullivan?
I'll second.
And Mr. Shorten seconds. Any discussion?
Summary is more opioid settlement funds.
We're on the routine consent agenda, so, okay, then seeing no further discussion, can I get a roll call, please?
Shorten.
Yes.
Sullivan.
Yes.
Krieger.
Yes.
Altoff.
Yes.
Lundberg.
Yes. All right, continuing on, we are now to the FY26 budget reviews. And first up, we have Sarah, and Mr. Adam, if you will be joining her
Right.
for the Community Development Block Grant.
Close.
Good morning.
You want us?
Good morning.
Good morning. Here, there you go.
Okay.
Whichever way you want to go. If you stand, I'll stand. How's it?
Okay.
Watch your back. What's your standing?
No, go ahead, sit down, go ahead.
All right, I will. We obviously prepared.
Yeah. Well, thank you for having me here today. I'm actually going to cover everything from community development, not just the community development block grant. And I wanted to start just by giving an overview because I do have people who come up to me and say, what exactly does community development do? And so we focus on enhancing the quality of life and promoting positive change within McHenry County. We work to address social, economic, and environmental issues with an emphasis on improving housing, infrastructure, and economic opportunities with a focus on low to moderate income residents. So in a sentence, essentially our division acts as a vital link between local communities and the resources that they need to thrive. Our key focus areas are housing. Of course, everyone knows there's a affordable housing crisis nationally and in McHenry County as well. And so housing is one of our key focus areas. Economic development, infrastructure as well, so developing and improving public facilities, roads, utilities, things like that, as well as community services. So providing funding to local non-for-profit agencies who support, of course, a wide variety of community needs, including homelessness, veterans, seniors, and domestic violence. And then another major responsibility that we have is, of course, grants management, managing and distributing the federal, state, and local grant funds that we receive to support projects. Key functions, so planning, developing comprehensive plans, for community development, including long-term. I'm sure you've heard us talk about the 5-year consolidated plan that we just submitted to HUD. Implementation, so overseeing, administering, and monitoring the implementation of projects and programs, which can include construction and rehabilitation, and as well as the service delivery of the not-for-profits. So coordinating efforts with other county departments, municipalities, as well as community organizations. Grant writing from time to time if we're going to be, that's something that I'd like to start focusing on, is securing new funding for projects, and then public outreach. So how do we learn what is needed in the community? We engage in conversations and meetings with residents, community stakeholders. We do surveys, but that's how we get the input back from the community as to what the needs are. So I put together this flow chart, which will kind of give you an idea of all the sources of funding that we receive. Of course, from the federal, we get the Community Development Block Grant, the Home Investment Partnership Program. We also oversee and participate in the Continuum of Care. We have the Lead Safe Homes Program, as well as sitting on the local board for the Emergency Food and Shelter Program. So that money doesn't come directly to us, but we do participate in that distribution decision. So there is some pass-through from the federal government as well that comes through the state of Illinois in the form of the Emergency Solutions Grant. And again, we participate through the COC in determining who receives that funding, which is why those two are in red. And then local property tax referendum that was passed in 2003, creating the Senior Services Grant Commission. So about $2 million from that that comes in, and then we distribute through grants to non-for-profit organizations, municipalities, and developers. Any questions so far? So we also are responsible for overseeing the entire grant process from start to finish. We post all the required notice of funding availabilities to the public, and so that they know when to apply and what those deadlines are. We manage, of course, all the databases as well as all of the grant applications. We check every application for eligibility. So, HUD guidelines as well as federal register, and then for the Senior Services Grant, that is also governed by Illinois statutes. Also work with many of the commissions to distribute that funding, making sure that all the commissioners have the documentation that they need prior to the grant deliberations. Attend all the meetings, of course, and then we submit the resolutions to the county board for final approval. From there, we execute all the grant agreements with, the municipalities and or non-for-profit, and then we manage and review all the quarterly reports and reimbursement requests that come in, that of course have to have documentation, and then monitor all projects for grant compliance, which is something that we're really going to focus on in the upcoming year. And just to give you an idea, this is primarily CDBG and home, but recently funded projects include the Hebron Township water main. There was an issue with, and a very big concern if there was ever a fire in the neighborhood, so that was a funded project. Turning Point Enhanced Security System, that's the local domestic violence shelter, so that was an important request. And then Habitat for Humanity, of course, the new construction of affordable housing. And then we also funded a housing for those recovering from addiction through the New Directions. In addition to the grant, we're also responsible for completing all of the grant reporting requirements, submitting the 5-year consolidated plan to HUD, an annual action plan as well. And then the CAPER, as we refer to it, I just think of that as our report card. how we have goals and outcomes, how did we do? And then, of course, complying with all county and HUD audits annually. And so Gary recently reported that we completed that 5-week process, and so just wanted to thank everyone for their help with that, especially the finance department, but no findings, so good news. And so how we accomplish all of this is, of course, we have 6 full-time equivalents in our division. Myself, of course, overseeing all of the programs. We have Brandon, who is our senior community development specialist. And as you can see, he has quite a bit on his plate right now. Overseeing CDBG, home, the continuum of care, HMIS, ESG, and then the treasury funding, which is about to close. So with the vacant position that we have, once that person is hired, that person will assume all of the continuum of care, HMIS, and ESG responsibilities. And then we have Connie, who is our Lead Safe Homes Program manager, and she's also going to be taking on environmental reviews. We're moving that from an external third party to internally. We have Eric, who oversees all the finances, the emergency food and shelter program, and is also going to provide a second set of eyes for the environmental reviews. And then we have Maria, who is overseeing the senior services grant and is also helping with the Lead Safe Homes program. So that's primarily where expenses come in. Salary and fringe for, of course, administration, the grant management, the monitoring, and any technical assistance that any non-for-profit might need. I did want to note that salaries and fringe are covered through the administrative portion of the federal grants. So when we get when the funding comes in, 20% of CDBG, 10% of home, 10% of the continuum of care, and 10% of lead is used for administration. And again, we're going to be focusing on recipient monitoring, which frankly has not been done in a number of years. So that's going to be our big focus for the next year. There was some restructuring that was done. We did have a second senior CD specialist position that was an grade 11E that we moved to an 8E so that we had just a community development specialist. We removed third-party temporary positions. We had been using, I think, Working World. And so that's going to be done internally now, and that'll be a savings of almost $100,000 a year. And then just remove some software programs that we just really didn't need. So that saved about $5,000. And then accomplishments and goals. All of the federal grants that we oversee now have formalized guidelines, either through HUD or the Federal Register. With the senior services grant, the bylaws and policies were revised. We also determined the senior age to be 60. And the application process has really been streamlined. We just met recently, and we're moving forward. For next year, we are going to have almost like a subcommittee that is going to do a really thorough financial review of all the applications. Again, the third-party temporary positions will now be, those environmental reviews will now be done internally. Successfully completed the 5-year consolidated plan and annual action plan. And then this hadn't really been done too much in the past, and I know Adam was with me and Derek Moorfield. We met in person with a lot of the local municipalities to really get their feedback for that 5-year plan. And again, the financial audit completed with no findings.
I'll add something to those meetings. We've taken that information, we've converted it to something that we can use. So we've reaching out to those municipalities, showing that the county has these opportunities available to them. That's great. But what would be successful is to remind them and give them something that's going to be there for them to kind of look back or update. And so we have a community investment plan. This is really what we've come up with, where we've taken these projects that are in their low to moderate income areas, and we've put them together by community. And once a year, we can send that to them and say, hey, are these still valid? Have you knocked these off? Have you added to them? And if you're interested, come apply. So it just keeps that engagement open with municipalities. That's all. Sorry.
No, you're fine. And then as far as goals, I've already kind of touched on some of these, but we do intend to formalize, policies and procedures, especially for CDBG and home, and we've already started that process. I think it's important to continue cross-training for all programs so that everyone in the department really has a good understanding of what everyone else does. And then, again, focusing on the monitoring of both the federal and local grants that we receive. Any questions for me? Comments? Yes.
I want to thank you. I want to highlight the fact that your structure's saving $135,000. I mean,
Thank you. We wanted to highlight that too.
it bears repeating, so thank you for that.
Thank you. Thank you, Mr. Short.
Are there any other questions? No? No. Thank you
Thank
so
you.
much.
Appreciate it.
This group does a fabulous job with everything that comes in. There's always more asks
Yes.
than what we have, and they do a great job of trying to weed through and prioritize different areas, and you guys do a great job.
Thank you.
Thank you.
And focus in and teach everybody again my standard statement about how we give away dollars. We don't give everyone 10 cents.
Yeah.
We actually try and find projects and fund projects that we know will not only help the community, but will actually thrive under additional funds rather than trying to be nice to everybody and give them not enough to actually manage any program well. And that's from them.
That is big. That is big. One of the things that we're looking at that we improved from the last consolidated plan to the consolidated plan going forward has been working with HUD, was to consolidate the number of goals. We had 19, 20 goals, and we couldn't touch those tail end. But the core functions are being addressed, but our scores were dragged down because we just didn't do anything. So one of the ways we're looking at that is really through dollars and cents. Is that what's our floor to manage and administer a grant? At what point are we spending $25,000 to administer a $20,000 grant? That's kind of where we're trying to find kind of home in. But thank you for
Well,
shining.
thank you for.
Thank you.
All right. Thought I took your chair.
We have Senior Services Grant Commission.
Pardon me?
Senior Service,
I think she.
is that pretty much?
touched on
it. Yeah.
Pretty much.
Yeah.
Ready.
You can answer any questions. We can do it again.
No.
Start at the top.
I listen.
Okay, next we have Workforce Network.
Yeah, it is pretty much.
Yeah. This is possible.
Good morning.
Good morning.
Morning.
How is everybody this morning?
Good.
Good. Well, thank you for allowing us to talk about Workforce Network and the Workforce Innovation Opportunity Act programs that we bring to the county's residents and employers. And so we didn't do a presentation. You've got all of it there. Hopefully most of you have been over to the center, visited, and gotten to know us. You are always welcome to refresh that. If you have any questions, call Jake. So the McHenry County Workforce Network is a department of McHenry County, and we're charged with connecting job seekers with meaningful, self-supporting employment by connecting them with employment opportunities, or if needed, the skills training necessary to obtain that employment. And we work with local area employers to uncover employment needs and direct our skilled workforce to those employers. Workforce Network is established by the Federal Workforce Innovation and Opportunity Act, or WIOA, W-I-O-A, and we are wholly funded through our grants that we receive. The majority of that being the federal WIOA appropriations through the U.S. Department of Labor. That being said, because it's the U.S. Department of Labor, we continue to watch the federal budget activities and discussions in D.C. with awareness and the implications of any of the unfolding processes and be mindful of our funding, continuing to deliver strong, meaningful programs and services to our residents and employers. Our budget is built on and fully funded by the Workforce Innovation Opportunity Act funds that we receive and some small grants that we receive from the state and from the Department of Commerce and Economic Opportunity. The Workforce Network county budget is neutral in that we are, again, wholly funded by our grants that we receive. We do not rely on county tax dollars. We do rely on your tax dollars paying your federal taxes so we can exist and help our customers. So, the grant covers all program operational expenses, including the customer paid training, which may be training at a training provider such as McHenry County College, First Institute, Eagle Training, or any other number of training providers that are approved through the state program. It also covers all supportive services. So somebody may not be able to attend class, we can help them with some transportation expense. Someone starts a new job and needs to get started with some childcare, we can offset some of the childcare expenses. That's all approved and allowable through the grant. And we also cover all staff and occupancy costs for our program. The workforce programs and services are prescribed, directed, and overseen by the U.S. Department of Labor and the State of Illinois Department of Commerce and Economic Opportunity, or DCEO, as we all know. The WIOA grant administration and delivery is monitored and audited by the Department of Labor, Department of Commerce and Economic Opportunity, McHenry County, and that includes Baker Tilly. We are proud to report that we did not have any program findings or fiscal findings in our recent DCO monitoring and our Baker Tilly single audit. WIOA funding, while being up and down over the past decade, has been relatively flat. We've been up in 2017, we received 1.9. That's where million to operate the grant. That's where we sit this year, but we've been down as low as 1.5 million in there. So we really haven't even kept up with the inflation. So we have to control our expenses internally to make sure that we're serving our customers. While we look to serve as many or more customers in the coming year, much of the additional funding is offset by increased program costs and training costs. We did see increased tuition to send individuals to McHenry County College and First Institute and Eagle Training, as well as many of the other state-approved training programs. We look at different options with the customer, what is most effective for them, and help them. But it is customer demand-driven. So we look for ways to control operational expenses through efficiencies. Our fiscal department allowed us to utilize an accounting assistant for program administration support. And we're looking at redeveloping career planner position to share in the duties of application eligibility administering. In the building that we share with the E911 board, we do host some specialty court activities such as Step Forward Reentry Employment Preparedness Series. a moral recognition therapy program, or MRT, that meets twice a week in our building, and a group support counseling that meets evenings twice a month. We also host a GED class taught by McHenry County College. All of these activity participants can and do take advantage of our career and work search services at the center. Many of them are actually eligible customers, and we serve them through training or work experience. Workforce Network helps to develop a strong, skilled workforce for our local area employers. And we help those underemployed find more engaging employment, and we assist unemployed workers to get back to work and to a career quickly. We support job seekers of all ages, from the ages of 16 on up till they determine that they don't want to be part of the workforce anymore. We help them learn and move along their lifelong journey of learning and career, supporting the county strategic plan goal number 3 of economic and workforce development.
Questions?
Please.
So I heard you say, a couple of them. I heard you say that, you've had, it's kind of steady at 1.7, but it's gone as low as 1.5. Talk a little bit about how you ultimately manage that loss of, that's a significant amount of money when you only have a 1.7. So how do you manage that internally?
2018 and 2019, we do look at other grant opportunities out there to supplement that. We look at reserving funds to make sure we're serving our customers. We never try to overstaff. It does get tight. We've had someone on an extended leave for about the past 11 weeks. So we've shared the duties rather than bring somebody in. Our program has so many requirements, administrative requirements through the U.S. Department of Labor, that in those 11 weeks, it takes almost 11 weeks to get somebody up and running. So then I'd be taking away from somebody else.
But the basic philosophy of what I'm hearing is, rather than eliminate or reduce programs, you seek opportunities to provide new revenue streams so that you're still providing the same service levels and amounts of people that you normally do.
Well, we were on our most recent application for the grants, because it was only about 100,000 more than last year. We were fairly flat on the number of individuals we serve. And we had that talk with the state of Illinois as to why those numbers were flat, because of our additional expenses there, but we've always met or exceeded the number of people. So last year, eligibility-wise, we served about 266 individuals by paying for tuition, paying for work experience, support services, job search, career coaching and such. But overall, we served about 6,500 unique individuals at the Workforce Center.
And I think too that we do shift initiatives as needed. To that point, last year we did go out for a grant we call 1E grant, which is more money for dislocated workers. So if we do see that need, that gives us the ability to do that. So say we do get less funding in those populations, we can go say, hey, let's go more towards this population versus that and get a little bit more funding in a way.
So 2 practical questions, and you do great work. I don't want to ever indicate I'm not doing that, but operationally. So from the moment you apply for a grant to the moment that you are awarded a grant, how long does that typically take? I mean, I'm looking, I know it's funny,
Well,
but
our program year
for
begins July 1st and runs through June 30th. So our program year 25 grant, which was, our grants we used to be notified in February or March, and I'm talking maybe a decade ago, of our upcoming funding for the new program year. And we used to have access to that funding. So we would do our grant application, we would come to committee with that grant application, we would go through the workforce board with that grant application and submit it to DCO. And that takes probably about 2 months, just because of the timing of calendars. Then we submit it to the state, they review it, and sign off on it or not, come back with questions. So we used to actually be able to access our funds sometime in late July for a July 1st start. This year, we may be able to access our funds by the 15th of October, after the first quarter. So when we get the grant, we have to spend 80% of it in the first program year. It's a 2-year grant. That 20% helps us sustain for that first quarter lag before we can access our funds.
And again, with that in mind, are these grants reimbursable, or do you get a draw every month that's a standard amount? Do they just give you the money and then you manage?
We draw down weekly, basically, for our expenses, because we can have no more than three days operating expenses in the bank. We work with Carrie and her team to develop this budget and work on that draw process all the time. So sometimes it gets tight, because sometimes it doesn't always process through DCO in a timely fashion.
I'm just trying to educate everybody with how that works, and in the event that there would ever be a need to draw on the general operating account to cover some of those expenses while we're waiting for grant dollars to come in, and how that plays out. That's the only reason why I'm asking.
That has happened a couple times when the state is shut down. And the county board has generously covered us for a payroll.
I assume.
And immediately upon deposit of the state funds, the WIOA funds, the county gets reimbursed. So it's generally only a couple days, but.
Again, please, I'm using you as an example,
okay.
But you know, oftentimes when you're talking about budgeting, it's different from the practical application of operating a budget, as we all know. And sometimes we really count on that general operating fund to help us offset some of those expenses that we know the money's coming in, but we don't have it today, so we borrow. So just, you know, that's sometimes why we want to keep that operating fund a little bit more nimble and flexible, because the demand, we never know, just because you operate completely out of grant.
Right. We you know, under the grant, we're not allowed to have a loan. We can't pay interest. We can't have a loan. So with a bank.
Thank you.
Yeah, a loan with a bank. So the county, being the recipient of the grant, is able to help cover some expenses when the flow of the funds from the state is slow.
But
because the funds come from the U.S. Department of Labor to the state of Illinois. They hold the overall bank account. And then based on our projected expenses for the week, and we try to do it every other week, we will put in a cash request on Friday that's supposed to be noted on Monday so that we can have it on Wednesday. Well, that doesn't always happen, does it, Gary?
well, then how long is that lag? Just
It depends, and I think some of the challenge they deal with is, you know, if there's a holiday, or wasn't there like a software issue, so they still have to maintain 3 days cash.
okay.
But it comes when it comes.
Yeah. We have taken to, that's the one management recommendation that we will take in our DCEO audit, is if they call us out on having more than 3 days cash on hand at any point in time, because we look at the cash flow and the historical experience of that. And we also watch the staffing at DCEO. When we looked at their last staff roster, 50% of their positions are vacant.
Are vacant.
Right.
And probably will remain that way for a while.
Yes.
But again, just an educational thing about how that actually operates with money coming in and money going out, and the restrictions or parameters of how you have to operate those grants. That's all I was going for.
So Laura does a really good job of keeping us up to date on that and advising us on what the projections are, especially if there's a Friday holiday or a Monday holiday like we're having here. So we
Long weekend, yeah.
we anticipate that and try to order ahead. But
Thank you. I appreciate that information. Thank you.
Anybody else have any questions? Okay. Thank you so much for coming
Well,
in.
thank you.
So just really quickly, before we move on to the health department, I think we can kind of lump the first three together as far as getting a consensus on moving them forward. Yeah, yes.
Yes.
Okay, thank you. Then we will move on to the health department.
Good morning. Okay, we're gonna start with some introductions. We have a big group here that we will not all fit at the table. So I want to start by, or they are going to make room for themselves at the table.
All right.
We will not all fit, but I will introduce them. So we'll start, we have two board members here today. Our Board of Health President, Mr. Joe Clark, and our Vice President, Mr. Kyle Markison. Then I want to introduce all the directors. They will be here to answer questions, and I will call on them at different points to, throughout the presentation. So we have Patty Nome. She is the Director of Environmental Health. Lindsay DeRate, who is the Director of Nursing. Megan Hack, who is the Director of Community Health. Mary Ellen Howell, who is the Director of Veterinary Public Health, aka Animal Control, and Ann Marin, who is our Director of Planning and Operations. So, give me a second, lots of stuff here. So, we're gonna start with the basics, just sort of framing what the health department does. We are here to protect and promote health, safety, and well-being in our community. And so that means everybody who lives here, comes here to work, comes here to play, visits, that is our role and responsibility. And our vision is to have an integrated public health system that supports health and well-being for all. So what that really means is collaborating with community partners and working together to ensure that we have a healthy community. I also want to point out that the health department is not just responsible for unincorporated McHenry County. We work the entire county. So that's just something to keep in mind. It's a little different than some of the other departments in the county that our responsibility actually goes to the four corners of the county. This is from the CDC. This is the 10 essential public health services, is a common way to frame the work of public health and all the activities that we should be undertaking to create a healthy community. And we consider ourselves a very high functioning local health department, and we adhere to very high practice standards. We also consistently rank very high in the county health rankings. That is a Robert Wood Johnson Foundation initiative with the University of Wisconsin, and it rates counties in every state, and we rank very high in the state of Illinois. Also, please keep in mind that investments in public health support entire populations and promote wellness and prevent illness in communities. And these investments are realized over many years. It's very difficult sometimes to have a very fast return on investment because we're in it for the long game. Okay, I will try a different one. Here's our Board of Health. We have our new board member. We haven't had a chance to get her picture yet, so that is why she appears as a shadow. And the Board of Health, the statutes in the state of Illinois statutes give the Board of Health certain powers and duties and responsibilities. So they set policy. They are required to enforce and observe all the laws necessary to preserve health. They set our budget, They determine the personnel, and they also determine the programs and services that we provide. We have a 12-member board. We are required to have 2 physicians, a dentist, a registered nurse, and then we have the county liaison, which is Ms. Altoff. They serve 3-year terms, except the board liaison is appointed on an annual basis. We are a certified local health department, so that means we have to meet certain requirements by the state. We have certain mandated local health protection programs. We're gonna go into more detail. You all have a sheet in front of you shortly. We are required to do a community health assessment and improvement plan every 5 years. That helps direct our programming and services. We are required to implement and take steps to address the priorities that come out of that. The community is surveyed, and we get key informant interviews with experts across the county to help us determine what those priorities are. So it's not just the health department. That is we work with the hospitals. They all participate and are part of the steering committee. We also have to have 24/7 on-call service. We have to have an emergency preparedness all hazards plan, a response disaster plan. We have 5 divisions, I think, and 5 directors who oversee them, 121 and a little bit of change in our FTEs, and roughly $8.3 million budget. So we wanted to, before we get into some of the numbers, talk a little bit about some of our mandated and essential services. Everything you see on this slide, and this is not a comprehensive list, we're gonna have the directors just say a little bit about these programs. These are not mandated programs, but we feel they are essential services, some of which vision and hearing, I just learned we've been providing for 54 years. We have been doing this in the community. So I'm gonna start with Patty to talk about the laboratory that we run downstairs in this building and give you a little background about the importance and what would happen if we didn't have the laboratory.
So in the Division of Environmental Health, we operate a small laboratory that's primarily for analysis of bacteriological samples for potable and
Maybe
surface water.
Patty, can you come up here?
I'm happy to.
I just said what everybody was thinking, that's.
Okay.
No,
I thought it was, I just started seeing it. Okay. So it's a small laboratory for analysis of bacteriological samples for potable and surface water, but we also use our lab for our activities related to mosquito analysis for West Nile virus, identification and preparation of our tick specimens for our participation in the statewide program for identifying tick-borne diseases. So local health departments are not required to have a laboratory, but the lab does support a variety of our mandated activities. For example, we're required to assure sampling of private and semi-private water wells, particularly if there's potential for a public health concern. This could be reports of illness, emergency events like historical flooding, or required follow-up of sampling of non-community public water supplies after unsatisfactory water sample results. We also conduct the required sampling of our 31 local beaches in McHenry County, and the beaches' open and closed status throughout the entire summer is based on those sample results. So our lab costs are supported by fees for service. For potable water, there's a fee essentially for every parameter that we analyze. But we have not historically charged fees for samples related to documented public health emergencies. So when we've had historical flooding in the past and we go out and we collect samples, we do those at no cost to prevent a potential for a large-scale public health issue. For our beach water analysis, we enter into agreements and charge a seasonal fee, which covers the cost of the sample collection, the sample analysis, and resamples that are required throughout the entire season. And that system really works really well for the beach operators and for us as well. So several years ago, there were several local private laboratories that accepted and analyzed private water samples, so we stopped accepting homeowner samples. And we did receive a significant number of complaints related to that due to the cost and due to the inconvenience. So once most of those labs closed, we began accepting homeowner samples again, and this is where we are now. Recently, we partnered with 4 of the townships, McHenry, Nunda, Algonquin, and Marengo, to provide sample bottles for their residents. We drop them off there, and then the residents can come and pick those up there instead of having to drive all the way to Woodstock. And we've really seen a significant increase in people sampling due to the convenience of the township sample drop-off program. If we didn't have our laboratory, residents' options for private well sampling would be very limited. Additionally, we would have to rely solely on a private or alternate lab to conduct our required sample analysis. And I do evaluate those costs. I mean, we look at that routinely. And I don't feel that using a private lab would represent any, significant savings, because I have to also factor in the travel time of staff to deliver samples. Particularly then there are time limits from the sample collection time and then, when they're analyzed. We'd probably have to limit our collection of samples to certain days. We'd lose our ability to accept and analyze samples 24/7, which we currently have. Did you want to say something?
You're talking about charging fees, et cetera. Are we also underneath the parameters that government can't make money off of providing services?
Sure.
I'm not being funny. When I was mayor, it was laid out by our legal advisors, the government can't charge more for a service to have a profit. So you charge what the service costs us, right?
Right, and there's guidelines on the fees that we charge. Some we can set, some we have to use a third party to establish what that fee will be. Said we're gonna be looking at her fees this year. We've kind of projected in about a 3% increase, but just cover costs, that's all we wanna do.
I don't mean to do, I just don't know what people know and what they don't know, so I'm throwing out everything I think is important for you guys to know. Thank you.
Okay, so beaches would also stay closed longer because we commonly sample those over the weekend if necessary, and that wouldn't be an option if we used an alternate lab. And then most significantly, I think that many homeowners would not routinely test their private water wells at all, which we do recommend are tested annually, and then it would severely restrict our ability to respond to emergencies as they arise. So I'm happy to answer questions if there are any on the laboratory.
Do we want to ask questions now at the end?
Or we can have it's up to you how you want to do it.
If you have a question for
It's
Patty, I think it's, relevant to.
It's worth pointing out that the health department is very large, not necessarily in size, but in scope. And there's a ton of things, and we're gonna hear about a number of different things. So if you're gonna hold questions to the end, it might be a little.
I think if you
Sure.
have a question for.
I just have one, I think I have one question.
Okay.
So you said if we didn't have a lab, it's not necessary, but if we didn't have a lab, there's certain negatives to it, right?
Mm-hmm.
But then you said you evaluate those costs. What are the costs roughly, if you have it, that you say cost the county to do this versus what would like the comparable cost be of just using a private lab?
Right, so I did look at those numbers, and so I would say.
I won't hold you to it.
No, it's okay.
Ballpark.
I actually do know it.
Okay.
So if we offset the revenue costs, it's approximately in the range of $30,000 for the lab. That's above and beyond the costs that we get. If we did go to an alternate laboratory, for instance, we couldn't get the private lab to give us actually their list, but it's significantly more. So I had to utilize another local health department, so I used Lake County. So it would cost us approximately $60,000 a year just for that. That's just for the samples alone. That's not, going to and from the laboratory, and then the staff time I would have to factor in, particularly on the number of days of weeks that we would, of the week that we would do it.
And then do we have dedicated personnel for the lab? Or?
We do. It's actually less than one full-time FTE because what we try to do is we try to have multiple people that can do the task so that we can respond as necessary, but it's at 0.95 FTE for all the laboratory activities.
And does that 30,000 include their salary, or is that just strictly expense?
Yes. So when I do it, I put in, those costs and then we offset with,
Okay.
with the others, so it's not a huge amount.
To touch on that lab just as itself, so I used to live in Boone County, right, and I was out in the country, and I would want my water tested, and I also served, for the record, I served on Boone County's Board of Health, so I have a little bit of dangerous knowledge. And when I would have my water tested, we didn't do testing in county, so it had to go outside of county. And it was a significant frustration for me to get a lab, get a sample tested, get it in a timely manner to get out to out of county lab. We test for Boone County, or I don't know if it went to Winnebago.
We have in the past, but they're currently using Winnebago.
Okay, so as a homeowner, that was a big benefit, moving here to have my water tested.
So talk about that a little bit, Patty. In the event that we actually looked at some type of eliminating those lab services done by the county,
Right.
what happens to the time frame of us finding a private contractor to do all of that work for us? Does that time frame get extended, do you think? Do they reply as rapidly as we do? What's the downside to that?
Well, I think the downside would be availability, because we can sample 7 days a week, and oftentimes we do if there's any type of issue. But there is a slight delay because we're bringing them over, we try to bring them over in groups of samples, and then, they're going to analyze those, and then we get them back, and then they come to us, and then they go to the homeowner. So there's kind of additional steps in there, to try to get the services that we do directly.
Thank you.
Does that make sense?
Yeah, that answered it.
Anything else?
Yes, sir. Is the bulk of the testing that's done in the lab on water samples from wells, or is it, because you mentioned wells, mosquitoes, ticks, and then the beach water. Is the bulk of it?
Yes, the bulk of it would be potable water, and that would be the private wells, semi-private wells, which are just not owner occupied. And then we have nearly 300 non-community public water wells, and those are the ones that serve a segment of the population. Could be a school, a business, a restaurant, those types of things. Those are non-communities. So the bulk would be potable water supplies.
Sorry, one more question.
Sure.
How many potable water, samples do you roughly do a year?
Yes, so I didn't break it out by potable versus non-potable, but I would say probably about 2,500 because we did around 3,000 activities, samples last year, different types.
Thank you,
Okay,
Patty.
thank you.
I will just add my 2 cents as a business owner that it is very convenient for us to have this lab. And I honestly think the amount that it costs the county is, well worth it.
Thank you.
Okay, so next, Lindsay, are you ready to talk about IBCCP? IBCCP stands for the Illinois Breast and Cervical Cancer Program.
So the Illinois Breast and Cervical Cancer Program has been at the McLean County Department of Health since 2007. It provides breast cancer and cervical cancer screenings to women ages 21 to 64 who are uninsured, underinsured, high deductible with insurance, and or those who are not eligible to receive Medicare Part B. Additionally, the mission of IBCCP is to provide early detection through education, awareness, and access to preventative screening tests. It provides clinical navigation for women in helping to make appointments for screening, testing, and necessary follow-up, and improves and expedites access to care. If a woman receives a diagnosis and doesn't have ability to, she doesn't have insurance, they can fast track their access to Medicaid and get them an appointment and treatment within a week. Felicity has done an excellent job of making connections within the community, and we're very proud of our team and the connections that they've built with Gabers Cancer Center and other entities within the county and across the area. We have room to serve more people for sure. Mid-year, we had a caseload of 299. We're generally looking at a caseload between 500 and 600. There is a higher incident rate of breast cancer, so cases per 100,000 people. In McHenry County, the average is 152.8. In Illinois, the average is 133.6, so that's per 100,000 people. So slightly average for breast cancer incident rates. I just want to highlight that we serve a lot of women, and even just one woman who came in who hadn't had, I don't want to get into specifics, but she did not know, she was coming in for breast mammography, and the team insisted that she go in for cervical cancer screening, and it turned out that she did in fact need treatment. Like she thanked the team, like, you saved my life. Or like we're changing people's lives and ensuring that they have this access to care and ensuring that they're serving the preventative screens that they need. So while we are not mandated, I do or would argue that we are an essential service to the community and have provided as such. So the funding that we receive from the county, we are primarily covered by the grant itself and in an additional program, the Illinois Wise Women. So we have 2 grants associated with this program. IBCCP is the umbrella, Wise Women falls under it. The funding that we receive through those 2 grants primarily offsets our costs. However, the county offsets that with for staffing. And if we see a higher incidence of necessitating advanced screening or treatment, additional costs can be offset on the county match.
So percentage-wise, part of it is grant funded, you're saying part of it is county funded.
Yes.
Overall, what is the percentage of grant funding that supports this program?
Do you have that number? I was just gonna try to look it up. It's like, the grant itself is about 430,000.
481, and we have another grant which will
Thousand.
expand.
Yeah,
481,000.
yeah, it's a big grant.
And then
And
the
the-
other grant we had was at 160,000. However, that the Wise Woman grant is less until we acquire more patients within that. So
There's a sliding
so
scale.
there is, like, as we get more patients, we
Increase
can increase our grant for that, which we're working on to have
So
more.
it's one,
The county match is $158,000.
Thank you, that's what I needed.
and it's 160, the grant you were just talking about.
Wise Woman.
But it can go up.
The
No, we're
IBCCP
less than
portion is like
160 right now.
over $400,000
Okay.
grant dollars that we receive.
And then we were talking about $160,000.
We don't have 160 right now.
Got you. We're trying to get it.
We're trying to get,
Okay.
yes.
So, what happens if you don't get it? How does that ultimately
If
affect
we
the
don't
program?
get which, the match or the grant?
The grant.
We have the grant, we just previously had, more patients.
I don't care if you have it
So
or
if
you
the
don't.
grant-
What
if the
I'm
grant
asking
goes
you,
away-
what happens
If
if
we
the
lost
grant goes
IBCCP?
away, what happens to the program? That's what I'm asking.
There is no program then. The program is run through the state, so there is no program for us to run. That would be true for some, but not all of our grants. So, the WIC grant, Women, Infants, and Children grant, is the same thing. It is a program. If that grant goes away, and that's like over $800,000, I think, grant, there wouldn't be a program for us to operate. But
So
these
that's
are grants that we have got year over year over year. These are recurring grants that we.
Understood. I just wanted to understand, if the money goes away, the program goes away, right?
But not for all the grants, and I'll give you an example.
But this
But
one
this
that we're
one,
talking
yep,
about. Yeah,
correct.
That's what, so I'm talking about.
You're most interested in the cost of the county outlay compared to the income and cost of the grant, and what does it take to get the grant? If we don't have the county dollars, then we can't administer the grant. The county dollars, in this case, you said 150,000,
158,000 is the county match.
say $160,000. The grant money in total sounds like it's $750,000, somewhere around there, the 2 of them together, 480,000,
But it fluctuates year to year, but
Fluctuates,
so
yeah.
I have to say, like, for this year, I have the $460,000 from this, and we have approximately 60 to 80 on the other, with an opportunity to grow to where we were at 160. That's a 2-year grant. I know we're talking about a 1-year period, so you're looking, we have opportunity to grow our dollars, which we are always trying to do.
And what's the dollar match on the county's end? Obviously, more dollars via grant.
It's been 158. I couldn't tell you exactly the history of that
I
number,
guess
but
what I'm asking is, if the grant grows, does our county match
No.
grow with it?
no, it's
Okay.
stayed at that 158 ever since I've been here. It's just been 158.
So every dollar the county contributes in this sense, they get back about more than $6
Yeah, it's like,
in funding from grant sources. Like many programs within the health department, we are so fortunate to be grant supported. But if we don't have that initial outlay, then those things don't exist. And to put this in perspective, right, this program was not very well known to me, you know, as a man, as, you know, it is what it is, right? But this program supports so many people that I learned about being here. We talk about the breast cancer screenings and all the other things they do. What is the mortality rate in this county, right? So it's like the lowest year that we've had in the last 5 years, 400,000 was 10.3 fatalities from breast cancer, right? So times 3 for over 300,000 people, it's 30 women who died in 2023. That was the lowest year that we had. The Sheriff's Department, which I have a lot of great things to say about, if there was someone running around shooting 30 women a year and killing them, this would be, I mean, I'm just trying to put it in perspective. We don't advertise this at all in this scope, but there are people that benefit incredibly that have nowhere else to go. And you know, we have an anecdote here of a good outcome, and that's one of the things I've told you when I've been before you before, that I want to make sure we are advertising these successes. So this is a big dollars and cents meeting, but there's a personal connection here, and the county gets an incredible benefit from these.
Other questions for
Other
Lindsay?
questions for this program?
Did I make that too serious?
No, it's so good. So good. We're driving home the personal meaning behind it. And
I have a question. Are all the women you're serving county residents?
Yes. Do they come in?
Is that a requirement?
If they weren't McHenry County residents, I believe that they would work with them to ensure that they found help. But I believe that they have to be McHenry County residents.
I believe so too. But we wouldn't reject them out of hand.
I'm not saying,
Yeah.
come out the door, I'm just
You're
asking a
being a male,
question.
too. That's about
No, I asked the question to be fair.
Yeah.
I'm just busting them over here.
Yeah, it's a good question.
People aren't traveling here to take advantage of the program, right? But it is a great one.
But most county programs offer this, do they not?
I don't know that everybody has this program available to them.
Lake County?
I'm sure some of the bigger ones, but I
think
couldn't
so, too.
honestly tell you.
Our collar county areas, yeah.
Yeah. They wouldn't want to leave that money on the table to support the residents.
Okay,
Thank you so much.
Thank you.
so now Mary Ellen is gonna talk about the Adoption Center.
Good morning.
Good morning.
Morning.
So the Adoption Center is just one small part of what we do. Animal control, or the veterinary division, is tasked with certain mandates from the state. And so we are mandated to take in stray animals, we're mandated to take in sick and injured wildlife, we do take in sick or injured feral cats. Sometimes we work with farm animals, it could be goats, pigs, 6 roosters in our garage kind of thing. So we only take in about 1,000 cats and dogs a year. We adopt out about 300 cats and dogs a year, but we have so many other animals that we work with. So the Adoption Center is not a mandate, but we are mandated to have a disposition for every animal that comes into our facility. So that could be adoption, that could be transfer, that could be, sadly, euthanasia. It could be that we hold animals for a good amount of time to adopt them out or transfer them. But if you know anything about the climate right now, rescues are saturated. We have 12+ rescues in McHenry County. Only maybe 3 of them are brick and mortar, have a facility, and the rest of them are using fosters. That's people, volunteers that come in to watch their animals, and they don't have space. So we transfer about 1,000 cats and dogs a year. We do transfer bunnies and guinea pigs to a couple of the rescues. But we have to have an outlet for those animals that we can't transfer, that are adoptable, or I call them the gray area cats and dogs, where they need a little bit of work to get adoptable. Or there's some rescue that could take them but can't take them this month, so they'll take them next month. So our Adoption Center, although not mandated in itself, we have to have a disposition. So having the Adoption Center is a very critical part of our program. The Adoption Center maybe brings in $25,000, $30,000 a year. We have very minimal staff that are directed straight to the adoptions part of our center.
our animal control officers actually care and clean for our dogs every day, our adoptable dogs. Most of our kennel staff take care of cats, or like I said, we might have reptiles. We had an owl recently, we had some parrots. They're taking care of the other animals besides the dogs. And then we have a number of volunteers. We have about an equivalent of 1 FTE of volunteer time each year. So about anywhere from 1,300 to 1,900 hours of time volunteers give us, which is kind of nice because that's an extra person. We used to have 3, I want to say, maybe 3.5 kennel techs. We actually don't have any kennel techs right now. We have the officers who assist us. We have a adoption coordinator who's also our volunteer coordinator. She has some responsibility for taking care of those animals. Then we have our community resource officer who spends part of his day taking care of some of the animals. And then we have 1 internal specialist, that's what we call her, because she does work on any relinquished animals that come in. She helps the adoption coordinator with the adopted animals, and then she does a lot of the basic kennel work. Then we have a kennel coordinator who has to help intake the animals, transition the animals to wherever they're gonna go, make sure they get their vaccines or their surgeries if they need them, and then gets them ready for either adoption or transfer. So we saw an uptick in transfer during 2020, 2021, because we had shut down our facility a little bit for adoptions. And so I think the rescues, when they have time, they're really open to take our transfers from us. It's just they only have so much room for transfers.
Do you have an adoption, like a volunteer application that volunteers?
We do, it's online.
And what are some of the questions that are on that questionnaire for people to be eligible to volunteer their time?
We do have an age requirement. You have to be over 18, although we are working on a younger volunteer program, and we do have volunteers like from Eagle Scouts or something who want to do a project for us, or we once in a while will have someone who come in and just do tags or file paperwork or something, so they can be a little bit younger to do that. But they have to give us their information, tell us if they have volunteered anyplace else, tell us what their experience with animals are, and then we have an interview with them, and that coordinator does that interview.
The last time I looked, you had a question of, are you COVID vaccinated? Is that still a requirement? Oh, it's still on your questionnaire.
We'll take that off there. Yeah. So our volunteers don't have to be COVID vaccinated, so thank you for that question. Sure. Any other questions? Okay.
So it brings in $30,000 a year. What's the overall cost for the adoption center?
That's a good question because that's just one small component. I want to say that it costs us somewhere around $18 or $20 per animal, depending how long they stay there. So we had a longer length of stay, so our average was 20 days, and now we're down to 10 days. And when I say 10 days, you have to remember that any stray animal must be held for 7 business days, which is really 10 days. So, sorry.
No, go on, I'll ask.
I was just going to say that overall, our program brings in, with our fee for service or our registration fees, about $1.2 million a year. So that pretty much covers our costs. So really, adoption really turns out to be a wash.
And when's the last time we reviewed those fees? Did we not?
2022 is the last time that we updated our fee ordinance.
We are talking about bringing those fees forward and making some slight adjustments with them, because most of our fees are on dogs. Our cat fees are a little bit lower, but we do a lot of activities. I mean, we do 10,000 to 12,000 field interactions a year. And I'll tell you, a lot of those are cats. So I think if we're talking about serving the community, the cat fees probably should come up a little bit.
The board member that owned a lot of cats, that's one of the problems. Not saying who it was. But
do you guys offer informational, I guess, for residents to, say a farm has 10 barn cats, I try to fix all of our feral cats that people tend to drop off because we are the farm for wayward animals, I feel. I mean, are there facilities within the county for lower cost?
Spay and neuter.
Yeah, or
So-
for other services, really?
So to keep our costs down, we spay and neuter our animals in-house. There are a couple of programs around the county that offer, they call it TNR, but really they'll do barn cats too.
Okay.
And there's about 3 vets in the county that offer a lower price package for that.
Do we have like an area on the website or just some information for people to
I could send it to you.
find that
I
out,
can send it
or
to you.
just have access to?
I think she wants it in general, as if for the general population, so
Yeah,
a way for them to
yeah.
access that on their website.
Because there are so many times I see on Facebook that question, you know, they caught this cat, you know, they just want to take it to get it spayed or neutered.
So we do have some approved programs in the county, so that's not, when I say approved program, it's not us doing it, it's a partner who does it.
Okay.
And usually we're providing somebody that information, and if they're not hearing back or they need something more, then we're making that contact with them. So, I was gonna say something else, I don't remember what it was. I apologize.
You brought the average adoption day range from 20 to 10. Did that just happen, or?
I think we worked really, well, I don't know if you've ever noticed, but I'm actually very proud of this because our adoption volunteer coordinator works very, very hard. Our Facebook page gets 6.3 million views to date a year. That's a lot. I mean, we averaged in the past 2 million views a year of our page. So she's working very hard to make those connections, getting people to share the things that we have on there. So I think more and more of the population is knowing some of those things. We could actually, I don't know that we've ever put that on our Facebook page. We do have a little barn program for us. If we have an animal that isn't really feral for TNR, but isn't adoptable, then we do have a little barn program when we place animals in barns. So we could look at doing a little bit more of that advertising on our Facebook pages and our other social media.
I do follow the page. It gets a lot of interaction. It really does. So
She
thank
works
you.
very hard.
Great job.
Commend her, tell her the committee
Yeah,
actually said, you know,
Are
nice
you
work.
watching?
You can tell her to fast forward to this part of the meeting.
Any other
Can
questions?
you provide Ms. Unbergen with a list of referrals for the spay and neuter
Yeah.
programs?
So we have a list of referrals of the veterinarians, but we could add in a list on there of ones that tend to do the TNR, just so people have our resource as well as that other organization's
I
resource.
think having that information available to the public is pretty priceless for.
Yes. If I had my way, we would have a low-cost spay and neuter ourselves, but we have to sort of stick with our mandates right now.
Okay, any other questions?
Well, thank you.
Okay.
Okay,
Thank
and
you
we
so
have
much.
one more program we're highlighting, which is vision and hearing. Last one, hopefully not least.
Okay. We wanted to highlight this program just because it's a good example of something that's mandated by the state, but not for us, for the schools.
I was standing in his way.
Oh.
So it's been mandated for the schools since, I looked it up, 1957. But we've been doing the screenings at the health department since 1971. So we currently have 2 full-time vision and hearing screeners. They have to be certified by IDPH. We do have 1 employee who is a backup, so it's not her regular job, but she will fill in because the girls are in the school almost every single day during the school year. So sometimes people get sick or they, so we needed to have a backup. So we do have 1 backup person who is certified. So if this program, we've had it for so long, we do we charge the school a fee, and then we have a grant funding that does pre-K only, and then, what's our other funding? Medicaid, so we do bill Medicaid for these screenings. So the schools, we have only raised our fees 3 times since we started this program. We did raise it significantly like 7 years ago, and then we did lose a couple schools during that time, but then they ended up coming back to us because they just don't have the capacity to be able to do these screenings. So we've been offering a service for them, and even if we were to stop it, like the schools, it would take them years to be able to get on board. One of the reasons is the state doesn't have certified trainings very often. So they will only offer those twice a year. So it's really, really, really hard to get screeners in, or people trained to be certified screeners. And right now we do serve every school district except for 2 in our county. So, any questions about that?
Are we charging what it costs?
So right now we charge what Medicaid reimburses us because we can't charge more than that.
Right.
So we do charge this, yes, exactly the same.
Thank you.
So when you say
That was the right answer.
when you say there was a significant raise 7 years ago, that was just tied to Medicaid?
Yes.
Okay.
We started out charging initially $1.50 for screening, and then
Which
it went
was,
to
I
$2.50.
assume, less than Medicaid?
Yeah, that was way less, yeah. And then it was $2.50 for as long as I can remember. And then we started charging $7 a screening recently.
So we're at the maximum?
Yes.
Okay.
Yeah. Unless Medicaid increases their reimbursement, then we could up ours too.
And what does it cost the county every year? Did you say this?
So this program, between those 3 funding sources, does almost cover itself, but not exactly. I mean, it's probably $10,000 difference.
Okay.
Minimum.
Did you say, did I hear you say too that these are required services?
By the state for the schools.
For all these,
Yeah.
they're required to do it. We're not required to provide it. But without us,
They wouldn't be able to do it.
Correct. So somebody has to.
They find a way to do it because they have to. They
Yeah.
find a way to do it.
and they would probably cost more than $7.
Yeah, I'm certain it would.
Yeah, and
I'm certain it would, but
Wait,
we have
why
our
could-
limitations.
Why would they be able to charge more in Medicaid, but we can't?
Because they charge a private provider to come and do those
It
services.
would cost them more, it wouldn't, yeah.
And
So
they
now, instead of your health department providing it for the most
Medicare costs.
economic cost you could do, someone's gonna come
But
and charge.
that makes sense, okay.
So then your taxes would go up from your school district.
They are good up anyway, yeah.
And we had, actually, one of our screeners broke her arm, I don't know, maybe 7 years ago. And so we had to look into like contractors that could do this for us, and the price was so significant, there was no way the schools could afford that. They were charging like $45 a child to screen them, so it was just it's not a.
And that $10,000, I guess, expense for the county, that's salaries, it's equipment, time?
Yeah.
Yeah, okay.
Other questions for Megan?
Any other questions? Okay, well, thank you so much for coming in.
All right, we'll keep going, moving on. Okay, so this, we wanted to just kind of break out the portion of the revenue that we take in. So the orange bar represents, and you can see it fluctuates, the grant revenue. The blue bars are all the other revenue we take in, the fines, the fees, fee for service, all of that. So it's a pretty significant amount. And in the next slides, we'll show you the expense side. And, okay, you want to go back?
to this?
Yeah,
So when the orange is grant revenue, right?
correct.
And you're saying, like, for 2022, it was roughly $4.5 million?
No. If you look at the bottom, so
Yeah.
look at the bottom bars,
Got you.
it was
Okay.
1.89 million represents the grant. The total revenue that we took in, was over
Was for,
four.
right.
Correct.
Understood.
Okay, is that clear?
Yep.
Okay, because all my charts are like this, so let's make sure it's clear. Okay, so this is our expenses. In this case, we've broken it out by what's covered by the revenue we take in versus what's not covered by the revenue. That has to get made up elsewhere.
It's not all grants, it's fees too.
It's correct.
Fees and.
Correct. So keep in mind, I mean, it's already been touched on a little bit. This doesn't include any changes to our fines or fees or getting additional grants. This is just kind of status quo. And we have been talking about, and the county's been talking about raising fees. So we have been looking at that at each division level to see what additional fees we could take in. This also doesn't include we have been working to try to do better on our billing so that we can recoup more costs or see what other services we can bill for.
And when Carrie did her 3-year budget projection for the board earlier this month, we factored in a 3% fee increase. That's kind of arbitrary, but we knew there would be some fee increase, and we just plugged that in as a placeholder. Could be more, but Board of Health will work on the fees.
And when was the last time we increased fees?
2022. So it's been a few years.
But we had high inflation in between that time.
Correct. So costs have
Just-
gone up.
Just throwing out my stuff.
Did you have a question on this one?
Yeah, so the expense is not covered by revenue. Clarify for them, where's that money coming from?
Well, the general fund.
Yeah, general operating.
You.
Yep. Okay, so wanted to really provide some context and perspective about how our FTEs have changed over time. So you can see back in 2010, we had a significantly higher FTE. And this does not include our TV staff. I excluded them from this to show, what is being covered by Department 51. So everything up to this point, including all the revenue, excludes tuberculosis program.
And we excluded the tuberculosis program because?
It has a separate, it's Department 52. It originally had its own levy, then we pulled it. The health department has always run the TB program, but it did used to have a separate levy. And back in, I'm gonna forget, we made a decision because at the time the county wanted to spend down any of the fund reserves, and TB had a fund reserve. TB is a requirement, and while it doesn't cost an extraordinary amount on a normal year where there's not an extremely drug-resistant case, but those can cost hundreds of thousands of dollars that the county will be responsible for to pay those costs. We are responsible for that. So we don't budget for that. We just budget for the basic staffing, the consultation, et cetera. But that's the step. We'll get to TB after this, but I just want to make sure everybody understands what's in this bucket here. So you can see going into the pandemic, we, from our perspective, did not have sufficient staffing capacity. And we worked with outside contractual staffing agencies to staff up to meet the emergency response needs. So between 2010 and 2020, we lost 31.61 positions. That's a 23% decrease. And we have 16 fewer positions now than in 2010. So we're still 11% down from where we were in 2010. There is something called the Public Health Accreditation Board, and they are an entity that standardizes public health departments across the United States. We are not FAB accredited, but we work towards, meeting those requirements. And there is a tool when comparing us on a national standard using the Public Health Accreditation Board's Public Health Workforce Calculator, we would need 9.62 positions, or a total of about 109 FTEs to meet the foundational capabilities and foundational areas of our county's population. So for the foundational piece, animal control would be pulled out. That's not considered part of that, because in many counties, it is run by the county and that does not fall under the health department. So I just want to give you some context around, from a national standard, we're still below that standard based on our population. And those numbers I just gave you are based on positions that include ARPA, right? So those numbers go up in terms of an increasing need when those ARPA positions, which we have 5, go away. So this is just a different way to look at our FTEs, same information packaged up a little differently. for the purposes of today, because public health and community health were once one very large division, I included it so that you could see the perspective. If I had them teased out originally, hopefully that makes sense. They are a separate entity now, that's why we have 5 divisions. And then to show you the IBCCP, that's the match. There is 1 FTE on the match currently. The administration uptick includes an ARPA, and then we just restructured a little bit this year and moved the epidemiologist under administration just because they serve the entire department. They're not exclusive to, they used to be rolled up under nursing. And speaking of the epidemiologists, we are fortunate to have a very competent and highly trained workforce in this regard. They do data surveillance. You have a sheet in front of you, an infographic that hopefully helps you understand all the work that the epidemiologists do. They are doing 4 times more than so before the pandemic, we are now doing 4 times more data surveillance, outbreak management, overdose cluster management. So we operate an opioid prevention and surveillance program. That is a community partnership with, I believe, the sheriff, local law enforcement, other community partners that are go into the community, do education. We do Narcan prevention. So we target our interventions based on what is happening in the community. And the EPIs are a key piece of that to identify the trends and see they are scouring the hospital data. They get that information on, I think it's a daily basis, to look at admissions, overdoses, and that is how we make alerts in the community based on that information.
Are any of those positions covered by grants?
So, yes, so we have 1 position that is, it used to be, that's on the general fund that we offset 50%, but because the grant went down a little bit, it's now at 40%. We offset that. One of those EPIs is on ARPA. The informaticist, that position helps clean the data, get it ready for them to do the trending and the analysis, is also on ARPA.
And that's through 2027?
2026, so that goes through the end of all the ARPA goes through the end of 2026.
15 more months.
Thank you. I'm glad that you could come up with that number quickly. Okay, so this is just a slightly different perspective to show you the difference when you remove those ARPA positions. And we would be, using that national standard. If we do not replace those ARPA positions, we will be, would need 8 to 14 additional FTEs, again, excluding animal control, to meet the foundational capabilities.
And what's that accreditation organization?
It's called Public Health Accreditation Board, and the tool's right on their website. And then again, this is just what it looks like without the ARPA positions.
And that organization is kind of a best practices
Absolutely.
across the country.
Yep. So it is that high-functioning health department, that accreditation in order to say that you meet all those standards.
To reiterate, you're excluding animal control because animal control does not need to be in that.
Is not part of that foundational capabilities, correct?
I'm seeing that.
Right, because you would see, yeah, if you add
I
in,
worked in 3 counties. 2 of them had animal control as part of the health department. 1 did not. 1 had animal control reporting to the county administrator, and I don't ever want to have that again.
okay. So here's another perspective on our positions supported by grants or ARPA. So we have 41 positions of our 121 that are supported through grants or ARPA. So that's over $2 million. 36 are funded by 15 different grants. 15 of those are at 100%. We have one general fund position that is also 100%. So that is $112,000 that we are not putting on the taxpayers. We have 21 general funded positions that we're offsetting with grants. Oftentimes, those are the positions, those are those mandated services that we're providing, and anytime we get a grant, I think we do an excellent job of offsetting the general fund whenever possible. We are making those decisions all the time, but sometimes grants go, get reduced, and then we have to make choices about how much we can offset the general fund.
And let's be very candid too. Our success at applying and then receiving grants are because we do meet those accredited standards, so people provide money to successful operations. They don't provide money to organizations that don't use it appropriately, right? So, I mean, they do, they're tied hand in hand.
And then, over this last year, so just using an example of IBCCP, because we had some disruptions, what we requested on the grant originally for staffing, we went back to the state, and because we had funds that were going to be left on the table. So instead of billing to the match, that $158,000, we moved almost all those expenses back over to the grant. So we tried to do that wherever possible, and that's an ongoing evaluation of how else we can use our dollars.
We spent 100% of that grant. I think we're at 110% in some of those areas. So just to be fair, like we used every dollar, there was no dollar left on the table.
And we appreciate it. Which reduces the, that draw on the match, I guess, is my point. Any questions about this slide?
The 5 ARPA funded positions, what are those positions?
So we have one EPI, one informaticist, one public health nurse, substance abuse facilitator, and a accounting assistant. I was like, whoop, I need to make sure I get that 5th one in.
I want to add, Carrie can help me, the health department is not the only department that has ARPA funded positions. We have one in IT and one in finance. We've committed to reevaluating these in the next budget year, whether or not they're going to continue.
Right, because right now they sunset in December of 2026.
Is that
barring no further action.
One in IT, and I know one in IT and one in finance. I don't know if there's any others.
Let's see, there's special courts.
Specialty courts.
Okay, I'm gonna move on. So just something else to keep in mind that, Mary Ellen touched a little bit on volunteers. Well, we have this whole other volunteer workforce that is known as the Medical Reserve Corps. And obviously during the pandemic, wow, they spent a lot of hours with us helping to respond. And so we can put dollars to that, the medical and non-medical. So you don't have to be a medical person to be part of the Medical Reserve Corps. So these don't get reflected in the budget anywhere. We do report out on this every year in our annual report, so that the board is aware. And they help us with everything, and Megan, jump in if I get it wrong, but they help us with our chronic disease prevention screenings, CPR classes. Anytime, hopefully you all saw the press release about Operation Dropbox. They come and they help sort. Those are exercises we do to plan and prepare for emergencies. And so they come in and volunteer their time to exercise with us so that they are also prepared should the need arise. Okay, before we talk about supplementals, just a couple of other things. So our salaries are definitely higher this year, in part. Now, we haven't really added any staffing. There was a 2.25 increase in our FTEs. That's fully covered on a grant, that increase. However, we have more, because in part of the efforts by the county to look at the compensation, we have been able, and some increases in salaries and grades, regrading and reclassing some things, our recruitment is going better and our retention is better. And we have more filled positions than we have had kind of going into prior budgets. So that is in part what you're seeing. And then that additional, the merit that hits in December of '25 is contributing to that increase.
And I don't know if anybody remembers if they were serving on administrative services, but there was a position that went unfilled for, what was it, 16, 18, I mean, it was a long period of time, and it wasn't for lack of effort, it was for lack of applicants. And that was of significant concern to us, and so there was a huge effort on the part of many departments to try and increase the, the attractiveness of working for McHenry County, as well as, again, just classifying some of those positions a little differently.
And then we also have a slight, if you included the grants, we would show about a 13, almost 14% decrease in our 40s and 50s, so in our contractual and commodities. But when you take that out, it's about 5% that we've been able to reduce our budget on our non-personnel expenses.
I have one quick question.
Sure.
You have 117.84 full-time employees. Is that?
Not including the TV. Yep.
And not including animal control, correct?
No, that includes animal control. That
okay.
includes animal control.
So is that positions that are open under the Department of Health?
So that's counting positions.
Or are they unfilled positions as well?
Those are unfilled positions. That whole FTE count includes unfilled positions, and I don't know if Carrie wants to talk about, but on the budgeting side, I don't think the county does not budget fully for unfilled positions.
So how many?
We anticipate unfilled
Yes.
positions in budget.
Oh, how many unfilled do we have right now?
Yeah, just roughly 5, 10.
Probably about 10.
15.
Oh, I don't have anybody in the room that can answer that question. And do you know
I
off the
won't
top of your
hold
head?
you to it.
No, you're right, it fluctuates, I think it's.
It fluctuates,
8 to 10.
Last administrative report, it was on 5 or 6.
but we've filled some. So yeah, I'm gonna say between 5 and 10. How's that?
And any of them long-term unfilled?
Yes,
Yeah.
we have one very long-term position we have not been able to fill. It is one of our management positions. It is the maternal child health coordinator. It is a nursing position, and we simply cannot compete with
$10,000 and $20,000 bonus
Yeah.
payments.
So that's something that we're trying to evaluate, and I think, we are always talking to HR and looking at ways to attract talent and what else we need to do to evaluate if our staff are graded appropriately.
Is that the only one that's been long-term, 6 months or more?
I think that is the one that sticks out to me.
Currently, yes.
Yeah.
I think so.
We've had them in the past, but
No, I know, I just was wondering how many right now.
it's been a
roughly.
strong focus to try and improve our retention and attracting good quality candidates. As we said, it's difficult when you have a skill set and a license and you could go to a hospital and make more money. This is really, a lot of times, is a labor of love and service. If people are in it for different reasons, you're not gonna find it palatable.
And maybe better hours for your family,
Yep.
right?
Sure.
Okay. Supplementals. We have some. Okay, but I'm gonna call on folks in the audience. So as you know, we are doing renovations in our Crystal Lake facility. Those renovations, there were some hiccups as we went through the permitting process. So in terms of budgeting, that's impacted the budget. So we need more Wi-Fi. As that building expands, in order for us to be efficient and do what we want to do with the drive-through, we have got to have Wi-Fi out there. And I think that is, and I don't know if you want to jump in, but the Wi-Fi is projected to be about $25,000. Do you have anything else you'd like to add?
Yes, we worked with IT and got a quote. originally was in the budget with ARPA, and then with the issue with Crystal Lake and having to do all the additional things we had to do with the stormwater and everything else, it switched about $90,000 out of what we had originally budgeted. So the Wi-Fi is very imperative so that we do not have spotty internet access and that we can operate efficiently. So it's going to add about 4 or 5 more Wi-Fi places to the expansion areas so that we can operate efficiently.
Why is it? I have Wi-Fi. It's not 25 grand a year.
Well, one of them is, it's just for, let's see, the boxes. So when the addition of the garage, which is a huge addition, it's going to be the drive-through, there's nothing in there. You have brick and cement and mortar all around the walls. So I don't think it's going to go into anywhere inside. So if we're having a drive-through, we wanted to be able to talk to at least the lab and then to the other side where the nursing division is. So it is kind of more complicated setup.
Is our IT basically purchasing the items needed for the Wi-Fi and installing it, or are we having like an outside company come in?
There is an outside company that they had gotten the estimates for. So that is who they're contracted with through the county, the city out for the Wi-Fi.
We didn't come up with this number.
Oh, I'm not.
It's one of those, I agree with you, it's like $25,000 and I'll go to Best Buy right now, but.
Well, I literally last night just had an internet guy come out to try and expand ours, and I expected him to quote me thousands of dollars, and it wasn't. But
It was
it's
higher
a
or
private
lower?
guy. No, it was, I was shocked at how low it was, honestly.
Spread the good word.
Yeah.
And these are the dollars that
Would he
we
come out to
receive
here?
from IT, because that, we look to the subject matter experts.
Yeah.
And that's what they.
But you want to make sure that whatever it is we get coordinates with what we currently have. That's also
Yeah.
going to limit us a little bit on what you can do and where you can go.
I understand, but there's systems you can put to broaden the scope of why. As someone who plays video games, I am aware of expanding internet to my basement. So it just seems, I don't know. I'm not in the field, I don't know.
Thank you, that's exactly correct.
But it just seems high to expand Wi-Fi over into
It's a large number.
Yeah, I get you.
I think we should have someone from IT to.
Sure, we can have them speak on it.
We revisit.
And how many kids?
Honestly,
Is that a price that's for over a period of years, or is that? I think
that's just to install.
Probably
right?
Install.
It's just the initial installation. Just trying to tell us crazy.
We want to talk to that guy. My husband does that stuff. I'm like, huh.
Okay, so we also have, I'm gonna move on just so that,
We're all stumped by Wi-Fi.
well, yeah. So
It's magic, I don't know.
3 items that we've put down for animal control. Now, we are gonna be working with county to see how much of this we can cover on this year's budget. But we wanna have it here if for some reason we're not able to cover those costs. And do you want to talk about maybe start with the freezer? The freezer is something, you heard Mary Ellen talking, we do have to freeze carcasses and specimens, and that is I would say a non-negotiable and has had to be fixed and repaired multiple times this past.
Sometimes we're holding animals for court cases as well. And those court cases, they can go on for 9 months, a year, sometimes more than that. And we have to hold all that evidence in our freezer. We've been kind of, gently walking along with this freezer. They fixed a little here, fixed a little there. I'll tell you, last winter, they probably had so much overtime in facilities because they were watching our temperatures all night long to make sure the freezer didn't get too low. And they basically said to us, in 2026, the freezer's gonna go. Well, if 2026 the freezer goes, and I've got, 30 animals in there, it's not gonna be pleasant for anyone. And we may have evidence in there that we need to utilize. We do have We have 2 other smaller freezers that when we can, we'll move some of those into them if we have a problem with the freezer. But it's really time. That freezer's been in there since 2007. Just like the next thing, the flooring has been in there since 2007. And it's time for us to do some of those capital, do we call those capital? Some of those things that need to be taken care of.
Okay, and maybe we'll just go through this if people have questions. So then,
Can I ask one thing?
Yep.
Mary Ellen, if you were housing an animal that was required by the judge for a court case, and the freezer shut down.
You could affect that court case.
Right. And what would we be forced to do in the immediate, would we have to contract with someone else? We'd have to have a cooler brought in, we would have
You
to.
would probably have to have some kind of substantially sized freezer brought in.
So it's a preventative cost.
It's a preventative cost, yes. And we would not want to affect somebody else's court case because we work with every jurisdiction of law enforcement in this county. So any of those cruelty cases that they're doing, if we've taken the animals on their behalf, then we are holding those animals as evidence.
Do you have budget or cost analysis for the freezers that you would need?
Yeah, they did get us an estimate. It's about $9,500 to $10,000 for the freezer. And then the flooring, I'll just jump right into the flooring. The flooring, like I said, has been there since 2007. It's an epoxy flooring. I have talked to facilities about we're probably not getting epoxy flooring again, but there are some other suitable that we could get on the flooring. It's going to cost us. It goes. If you've ever been in our facility, it's a square, and that square is where all the animals walk through, right? And then there's a kitchen area that has another set of that same flooring. And that's really to help keep down any zoonotic diseases that get into the building, any waste from the animals as they're moving through the building. Animals carry a lot in their fur. Animals sometimes have waste. And so we want to keep that out of our animal population best we can. And so having that special flooring there, easier for us to scrub and wash it, mop it as we need to. And like I said, it's been there since 2007. So it has a lot of nicks, scrapes, scratches. It's coming away from the walls. It's time to get some other coated material on there. And then the last one is the dryer. The dryer also 2007. And they've been pushing it along for us, but they're saying in the next year or two, that's why I wanted to kind of get it in our minds now, that dryer's gonna go. We do all our own laundry. We probably do 15 loads a day. We get donations of towels and blankets and such, but we don't want to throw those away. But best practice says you would sanitize them. So we're watching them, getting them into the dryer, making sure that we can utilize them there sanitized. And the dryer could be anywhere from 3 to 5. I really haven't got an estimate of the dryer yet, but I do know it's in my mind, and I want it to be in your mind.
And everybody should know that that dryer, if we buy it, is not gonna last 19 years.
Exactly.
Just saying.
Yeah.
The facilities have been very good to us on any issues we have over there with our equipment. It's just getting to be the time where some of that equipment is gonna have to be replaced.
What was the flooring cost again?
The flooring, that's okay. I was gonna say, part of the ARPA process, we did have them look at the flooring. We could not cover it under ARPA, but it's gonna be somewhere between 30 to 35.
Living trip hazards.
Yeah.
Floors.
Kyle does that to me all the time.
Oh, yeah.
There's
There
a
are some
trip.
big nicks in the floors that could potentially be trip hazard. And if you don't know, a good number of our volunteers are over the age of 60, 65, and they're taking our big, Rottweilers out for us, and we want them to be safe in the hallways too, as well as our staff.
I was there when the big Rottweilers were there.
Someone were-
Oh, yeah, lots of principals, if you like to know.
If
I have them
someone
all,
were,
I don't think my husband would kill.
if someone were to trip on the floor and were suffered an injury, who would be responsible for the cost of that care?
The county could potentially be responsible for that. Yes. We do
Preventative
have a shelter fund. I think it's in I thought I saw it in one of your slides. That shelter fund is meant to be used for the good of the animals. Typically, I'm using about $10,000 to $12,000 a year on medical for the animals, specialty toys if an animal has been there for a long time and we want to keep them socialized, we have to have certain toys for them to play with. Medical care, if an animal has to have an amputation, if an animal has to have a tail taken off, an animal has to have dental because it's maybe 8 or 9 years old and its teeth are just decrepit. We do a little bit more of that with that specialty fund. All of that fund is donations from the community. So we have people who donate through their work, we have people who donate just themselves, and all that money goes into that special fund for those things. We may be able to use some of that for some of our projects because, again, if the flooring is for the good of the animals, we may be able to use it for that. We're still discussing those. Any questions?
Okay, I'm going to keep going down the list. So the next one on the list is Board of Health compensation. This is something that is allowable per the statute. The Board of Health changed their bylaws. I'll turn it over to Mr. Clark.
You want to look at and point to a person that has brought this issue to the forefront, it's me. So you can blame me. The Board of Health, which was presented earlier with 12 members on the board, receives in advance of the meeting a board packet. It's probably not as grand as your board packet on the county board, but it's often in excess of 100 pages.
I'd say some months it's grander. Just saying.
So the board members have to spend time preparing in advance of the meeting, reviewing those board packets. We start our board meetings at 6:30 at night, and most often they go to at least 8 at night, sometimes 9, 9:30, 10 o'clock at night, going over all the material that we have to review and approve. In addition, just like you are here today, we have committee assignments. Those committees, I'm gonna say meet once every other month for each of the 4 main committees. Again, the board members have to review their packets, they have to participate in the committee hearings. Often some of the one committee in particular, the hearing committee, interacts with the public trying to resolve concerns or disputes. And it requires significant professionalism to represent the county in that manner in hearing their issues, their concerns, and trying to get a resolution that is satisfactory to all parties. The Board of Health does not receive any compensation of any kind. No reimbursement of expenses, no nothing. It is strictly a public service that we come in and participate. I am right now finishing my 11th year on the board, so I've seen this board over a number of years. And one of the things that I have observed is this committee does a fine job of recruiting people and interviewing them and making a selection and making a recommendation to the county board, and the county board does a fine job of making an appointment. And that member comes to us, but they're green. Yeah, just like on the county board, when you first sit on the county board, it's like, oh, it takes a while for you to become comfortable where you can offer input, information about the topics, and you can speak out. So I say it takes almost one complete term, 3 years, before we really have an experienced board member that's going to contribute for years and years to come. Well, when a new board member gets seated on the board, they're all excited. Every one of them. I've watched, even myself back in the day, excuse me, and then watching all these new board members, they're excited. Boy, they're going to make an impact on public health. And I'm here to give you my opinion, and this is going to be great. And some of that does take place. We do listen and seek input from the boards. But just like you here on a Thursday morning doing a committee hearing on budgets, that's what we end up doing. And it's boring, and it's time consuming, and it's like, I don't really want to listen to this stuff. But we have to listen to it. That's our role. Well, over a period of time, you see people losing interest because there is nothing for them as appreciation for their service to come to sit on the board. So when I began looking at this, I said to myself and Melissa that there's got to be a way that we can offset some of the expenses to the board members for the use of their cell phone, for the use of their computer, for their printer, for having a dress, for driving to and from the meetings, for hiring a babysitter to watch the children so they can go to meetings. There's got to be a way we can reimburse it. So we met with administration and we started reviewing the process. And there is actual
Statute.
No, not the statute. There is actual policy that does permit some of that reimbursement. The conversation centered around, well, boy, if I'm putting my fees coming from Harvard and he's coming from Crystal Lake and this one's coming from Woodstock, and they're all going to be different rates for your mileage reimbursement. If I've got a Verizon phone, it's going to be different than an AT&T phone. It's going to be an additional burden to do the accounting on that. Well, during the review, the discussion of this, one of the administrators identified that there is state statute that permits county board members to be compensated for their service. Well, let me step back. This began in 2024, this conversation. And the state statute is very specific on the rate and who is entitled to what. And so the conversation amongst us was, we would rather have the flat rate of compensation than to go through all this paperwork to try to get reimbursement for actual expenses. So that was the avenue that the goal that we had set that we were gonna try to pursue. It required us at the board level, the health board level, to amend our bylaws to permit the county board to set the compensation. And which we held committee meetings, the board members all had conversations. Most were in favor, some were not. Majority vote carried, everybody supported it, and it became part of our bylaws that the county board can offer compensation to the Board of Health members. The next item came up is, well, how much do you guys want? And here I will assume responsibility for making it clear. I didn't want to step on your toes. I didn't want to tell you how much to pay us. I wanted you to have the option to review the state statute and determine the rate of pay. That was not received well. They were, it was, the effort was, or the request was that give us a dollar amount. I want a dollar amount. Don't leave it up to us to do it. You give us a dollar amount. Well, by the time that took place in 2024, the budget year was approved and it was too late. So we began working on it for budget year 2025 going into 26 for this upcoming budget. So what I'm asking for is $100 per meeting, no, $100 per month for any board member that attends a meeting or a committee meeting that month. If they don't attend any meetings, they don't get anything. If they attend a board meeting and miss the committee meeting, they get it. If they attend a committee meeting but miss the board meeting, they get it. And it's only for the months that we have the meetings there. I think that will be received well by the Board of Health members in that, oh, I'm getting something. I'm getting a thank you of some kind. And will it cause retention? I think a little bit. Is it going to make it perfect? No. I can tell you in the 11 years I've been on the board, we haven't had a full board but for maybe 6 months in those 11 years. Especially when we're talking about professionals, the medical doctors, the dentists, and the nurses. It is really difficult to get them recruited to come do something for nothing. And then have the additional expenses that go along with serving. So that's my request. I'm speaking on behalf of the Board of Health to get put in for this upcoming budget.
And I'm gonna add one thing, and then I'm gonna ask Pete to kind of explain something else too, just clarification. And minimally, I will tell you that the request coming for a stipend for the board is certainly appropriate. But my observation is minimally, the chair should be compensated. That is a huge position. And there's a huge amount of work that goes in assisting with the prep of the agendas, et cetera. So I'm just, think about those things too, but minimally, you guys should think about that, if not full. But Pete, can you do me a favor and explain how this works? Because technically, it is the Board of Health that makes the decisions with regard to that, how the budget and how the money and all of those things are expended and where those resources go. So can you explain just real quickly the oversight that the board provides to the Board of Health and how that meshes with regard to money? I was going to ask you, Melissa, but I decided that I would dump on Pete a little bit.
Thank you, I appreciate that.
And Board of Health compensation notwithstanding, I mean, I think we sometimes need to remind ourselves that it's the county board's role to appropriate dollars to the Board of Health, and whatever that amount is. And with that amount, it's the Board of Health's role to prioritize how it's spending the money. What services are being provided by the health department? Where are the dollars being allocated? And that's why we have a Board of Health. It's to make these decisions on what are the priorities and what are the services that need to be provided to our residents.
And so while we can make some recommendations, and certainly I thank the Board of Health for being, like most of our other constitutional officers, being very collaborative with the county and working with administration on budgeting and how they spend their money and how they get their grants and all of those things. I just, again, we can make recommendations and suggestions, but inevitably, our job is to give them X amount of dollars. And they make a decision on what programs.
Amy, I thought about this a little bit the other night.
Please.
We have a parallel in the mental health board in some respects. Now, we know we just did a foundational change and put the mental health board on the sales tax, but when the mental health board was funded by a property tax, there was kind of an understanding that the county board is going to give you a levy allocation and the mental health board is going to figure out how to spend it. And there was a time or two in the not too distant past where there was some discussion on the county board floor about, do we want to fund this program? And then it was kind of a timeout. That's not our lane. The county board's lane is to allocate the money, and it's the mental health board's job to decide what the priorities are to be funded. And it's an exact parallel with the Board of Health. It's the county board's role to allocate the dollars, and it's the Board of Health's role to prioritize how it's going to be spent.
Thank you. That's, just, again, clarification.
I have a separate question. Can they raise it for current, because I know we've been having this discussion about other electeds where it has to be done before a certain date. So would it be applicable to currently sitting, or would they have to first serve out their term? Do we know? Does it matter?
I don't know. I suspect it's different because remember,
they're not elected.
Yeah, they're not elected. They're
appointed.
So it would probably be a difference in the law.
Or so archaic, this ancient thing, in the state, just odd. Slightly add to the perspective here, and I will confess straight out that I was one of the people that was like, I don't know if I want to get paid for this. But that is, and I will be fully honest with you, I'm a person who believes 100% in service, and that's not to denigrate Mr. Clark, his service over decades is incredible to this county and to many other communities and to all the other people that serve on it. And I really got to thinking about it, and the reason I did support this was that I may feel that to serve in this capacity is your gift to the county or to the communities that we serve, but you don't necessarily want to be harmed by your service. And it wasn't as clear to me when I was without a child, or single, right? And it is different now when I leave for a meeting at 5:45 and my daughter's begging me not to go, and the babysitter is there that I had to pay for to cover my time here. So in terms of harm, it's not like, I'm not really making it that emotional, but there is a cost, and to every family is different, and it's far be it from me to say what is appropriate and what is not. To touch slightly tangentially to that, the concern, the issue we've had with filling our mandated positions for physicians in particular, we have to beg, borrow, and steal to get some of these people on here. And again, one of our board members, Dr. McGuire, is a friend of mine who works, at a hospital out of the county, and I know her professionally, and was like, you should really help out with this. The schedule she works, right, is totally different, and it's a big ask. And she's a person who is a high power, high profile person in her life. She's an incredible professional. She's extremely technical. And then to ask you to come on your evenings away from your family, some of the only time you get off to serve like this. I'm not saying $100 a month is the thing that makes it even, but at least when your spouse comes to you and goes, you got to cut back on some of these things. You are involved in too much stuff. Well, at least the Board of Health pays us $100 so we can go to the freeze afterwards, or what have you. As you said, it's a minimal amount of money. I did get on board with it when my wife was after me.
And clarify that the board liaison is not part of the board.
Correct. It's
Just saying.
so 11 members, not 12.
And for clarification, the actual question to ask, what does the state law permit? The state statute permits up to $200 per member for the Board of Health and $400 for the chairman or president of the board per month. We're only asking for 100 across the board.
Okay, thank you.
Thank you.
Okay, we're getting close. So we have, I don't know, Patty, if you want to speak to this, but we are regrading a couple of positions to address work flows in environmental health.
Right, so for the past two individuals, really competent technical individuals in our private sewage and potable water program supervisor position, expressed many times just the overwhelming amount of work because there are so many sub-programs under those. So we worked with HR and Melissa and have regraded positions. So I'm proposing to split that position into two, regrade the original position down, which will create funding for this, which leaves a net cost of about $5,100, which we can cover through, these are fee-for-service programs, which we can cover with fee increases and or their grant eligible costs as well. So there would be a net zero cost to the general fund.
And before you go, maybe talk about the car.
Last request is for one additional vehicle. Currently, we're waiting for vehicles to come in. We work with the garage supervisor on that. But if we get all the cars that we have, he has ordered for us this year, what we will have is enough to have every field staff person have a vehicle, but it does not allow us to have one for a coordinator or a supervisor or someone to go out in the field to do something, and or when we have vehicles in the shop, it doesn't give, that person's kind of grounded without a vehicle to kind of switch out. So we are requesting a vehicle as well.
And I know I'm being really stupid, but can we talk a little bit about why we don't want people to use their personal cars to do that?
We can talk about that.
I'd be happy to.
Sure.
They're all in marked vehicles, clearly showing that they're health department personnel. I'd say over the last 5 years particularly, we've had quite a few incidents with staff being approached by angry people. We've had people followed down the road, things like that. So we feel that we don't want them in their personal vehicles, so it's clear that they are who they are. We do use logo wear too, so that people know that we are, health department personnel, and we feel it's really in their best interest from a safety perspective to do it that way.
Yes, thank you.
Patty's environmental staff is fully staffed now for the first time in a long.
3 to 4 years
Yeah.
at least. Yeah.
And the reality is when everybody is in the building, or everybody, the staff is full, it is a crunch on cars. And Gary and I have been working with the garage to try and get that number up. But yeah, when there's a vehicle that's out of service, it's a priority in the community. We don't budget for a health department vehicle. We set aside $700,000 for vehicles, and that competes with squads and all the other things. But we'll see if we can make this one happen.
Mr.
A
Sharp.
little car.
Sorry,
Let's do a little car.
quick clarification on the two positions. It's a split of one position into two,
Correct.
and you're downgrading
A
both
third.
positions?
Each of the reclassified positions is down a grade from the original. And then the original position will be reclassified down to an entry-level environmental health practitioner position.
Okay.
So that's what will free up funding.
And so each of those positions, one is for potable water, the other is for private sewage. How many people will be reporting up to them?
One will have 3 and one has 2. There's 7 people in those programs altogether.
And how many reports are currently done? At their current grade?
At their current grade, it would be none.
Okay.
Right. They're in an acting role, so, but in
I
other positions,
understand.
right, there was 0.
Okay.
Correct.
Thank you.
Thank you.
Okay, so that's essentially the end of our regular department. I know we haven't even touched on TV. I think the one thing I'd like to point out there as another savings to the county is we did utilize grant funding and moved about $65,000. There's only 2 positions funded on the TV program, or 2 positions there's 4.34 FTEs on TV, but 2 of those positions we're offsetting with grants in the amount of $65,000 that comes off the general fund. And that's all we have. I think we've been here, I don't even know, I didn't check what time we got started, but I think it's been
An hour. Been a while. But it was a nice presentation.
Yes.
Thank you.
Yes.
Very
Thank you
thorough,
for-
very well done.
Because it's gone so long, I'd just like to put a little bow on it. I don't know if you realize, I'm like the hype man for this, so we've talked about the marketing aspect here. I apologize.
Music.
Nice
And right on cue, got a little music with the hype there.
My new do not disturb was set for 2 hours, we've gone past that, so. You've seen this tremendous presentation that covers this wide area. Forgive me, most of you probably know what we do here and what's going on, but for anyone else watching or in the audience, public health covers such a wide area and we don't really talk about it, but it comes down to everything we do in our day. Do you like clean water? Yep. Do you eat out in McHenry County and you like clean food? Yep. Do you want to go to the beach and not get a bacterial infection? Yep. All of those things and many, many more are accomplished by the diligent public servants that we have operating in our 5 divisions. I understand and appreciate fully your job is to watch the dollars and cents, and you're trying to make a recommendation for the budget year coming forward, and it's a tough spot. I don't envy you that, just like I don't envy myself when we had these very same conversations. It is hard to pick and choose the winners and losers. I think that this presentation hopefully has done a good job of identifying how much this department does to fund itself, right? 2/3 or more, fluctuating somewhere around there, comes from money not from the general fund. And I don't know what it is for other county departments, but I would wonder how many dollars and cents get accumulated from different places rather than from the general fund. We talk about, even before, $1 spent on one of these programs gets you $6 or more coming back to you from another source that serves our constituents. These are sometimes programs that I say it fully, we don't always do a great job advertising it, and I wish we would do a better job advertising our successes and all the good that we bring to the county. When my daughter goes to camp and they closed the beach, the main beach, because bacterial overgrowth was there, nobody said, well, it was the health department came out and tested it, every day to make sure it was good and make sure my child doesn't come home with an infection or, whatever else. Those things have to happen. That touches on the intermingling of these services. It's very hard to cut out one of these portions. Mary Ellen talked about the adoption center. We don't actually have to run an adoption center, but we have to have a disposition for all these animals. So if the answer is not to just bring them in and then shoot them or something else terrible, you still might have to house them. How do you segregate one of those portions? The same thing with the, sorry, Mary Ellen.
They don't maybe shoot them.
We would never, obviously.
I'm not shooting the tree.
Yeah. It's a very,
Different analogy.
very dramatic, I apologize. But like the beach example, right? They have to be tested. We don't have to be the ones that test it. Vision screening, we don't have to be the ones that do it, but it has to be done. And it's only gonna cost more in other places. Public health is the source of prevention for so many of these different things. And the dollars you spend here saves you, nets you way more than that on the back end.
Can I ask you a question?
Yes.
We're talking about prevention. So with all the changes in the CDC, how do you see that affecting your roles, the changes in prevention that we talk about? We talk about, healthy lifestyles, getting the food dyes out of our food.
Sure.
Offsetting the cost of, the result of those things. Do you see any changes?
I don't necessarily right now see any changes in terms of what our core responsibilities are here in this state. We get most of our direction from IDPH. Some of that does come through CDC. But in terms of our communicable disease prevention, I don't see any of that. We don't really get into the food dye stuff. That's not our purview locally at the local level. But I can't say there won't be things that change. Right now the funding situation is relatively stable. That could change, and then we will have to address that if and when that happens. But I think our core programming, that's again driven by our community health assessments at the local level, that tells us what we need to do at the local level, and then our other core components of our work, I don't see changing dramatically right now.
I think that's an excellent question you brought up, and the other thing to touch on there is that all these divisions remain very agile. They're always looking for cost savings, and they want to be at the forefront of that. We have programs that have come out to support, healthier food, local farms, supporting the farmers markets, things like that. Those are all options, and we want to support those initiatives, and we have to stay nimble with those changing regulatory landscape. Just back to the prevention, an ounce of prevention is worth a pound of cure. Just one, couple of things to touch on. Epidemiology, the data analysis is a huge part of it, and we don't get enough airtime about that. That's how we know where to set our resources effectively, to be very efficient with those dollars and know where there's an emerging threat that we can take an additional stance to counteract. That doesn't have to be a communicable disease. We talked about opiates. So the surveillance that gets done there helps to save lives and reduce then the financial burden, because again, this is all prevention. If we don't do it on the front end, it will come back to us even worse on the back end. TB is a great example, right? We are mandated to look for that and treat it, and if we don't do a good job with that, a TB patient could cost the county hundreds of thousands of dollars.
And if I can jump in just briefly, to build on that, those EPIs are working, we're working with the schools all the time. We have these surveys and things that they complete, right, to see if there's something spreading in the schools. We provide that education. We help with that prevention and control. And that is a key role of the EPIs, and there was a strep throat outbreak a few years ago that just wasn't getting under control, and we were able to, identify that early, and then work with the schools to try to get it under control.
In closing, this department does an incredible amount of good, and it does it very efficiently. You've seen the numbers come down over the last decade, and our support of the community and commitment to that and to the dollars and cents remains very, very strong. I understand that you're looking for places to cut. What you trust us to do and appoint us to do and to keep an eye on is to try and recommend you places where it makes the most sense. Not all of these are technically mandated. we find them all to be essential. And I would hope that we could maintain what we have here, the budget that we've requested, with the caveat too that I would like to increase fees and fines and other places in a way to help offset that cost. There's a number of places, that's a conversation we've had that's ongoing, and we'd like to bring back to you when it's time to increase the fee ordinance.
You go back to the slide that showed revenue, what was it?
Oh, this one? Expenditures not covered by revenue?
Right.
Yeah.
So the expenses not covered by revenue, general fund, which translates to property taxes, correct?
Not necessarily. I mean, there's a lot of sources of revenue to the general fund.
Oh, that's true, sales tax, et
Sales
cetera.
tax,
Sure.
property tax. And to be honest, Melissa and I went back and forth a little bit on this slide because as someone mentioned, you know, we don't typically look at it by this metric because, you know, like county administration is 100% not covered by revenue.
Right.
And, you know, sheriff is this, so it's not, you know, some departments have access to sources of revenue and some don't. So
But it's a reminder, the general fund is not all property tax.
Correct.
40, no, not even, less
Less
than
than-
30% now.
yeah.
And if there is an increase, I'm assuming that that's one of the things we'll recommend as we move the budget forward, is to evaluate that. I mean, we're saying maybe 3%, maybe, you know, but then that reduces the expenses not covered by revenue, because obviously we're bringing in additional revenue.
But I think it's also what this graph shows is kind of what he touched on about being nimble is they have a lot of grants and they change all the time. And so, you know, and sometimes the grants are covering mandated services. So if the grant goes up or down, you know, that's gonna affect the pull from the other sources of revenue in the general fund. So it's good for that. But I don't like to just look and say, you know, they're gonna cost 38% of their expenses are gonna go to the general.
Right, because it may be 50 at some point, something.
Well, you can see in 23,
Yeah.
we covered a lot of our expenses, but we had a lot of grants. You know, so that's just gonna fluctuate, and the ability for us to offset the expenses not covered by revenue. Carrie's drilling it into me.
It really just shows like how many adjustments you're always making every day.
Which again is one of the reasons we talked about keeping that general operating fund at a higher level, because that's where we play, you know. That's that nest egg. So if there are any more questions, I'll just say that with the understanding that we're going to review the current fee structure, I would move the budget as presented forward to the full board for consideration.
I would second that, but I think I've said this in other meetings, but I feel like I should make it clear in case anyone was mistaken. I think there's obviously gonna have to be a discussion amongst all the department budgets. Because what are we, $7 million short if we don't raise taxes through next year?
It's not that high.
No?
5.
If it's flat, it's about 5.
Okay, 5 million. So if we don't want to raise taxes, there's $5 million over the next 2 years that we have to cut. Yeah. Everything I've seen so far has been reasonable. Reasonable from you guys, reasonable from other departments. At some point, there's going to be a tough discussion, and that's going to happen at the committee of the whole, and the board as a whole. But I saw nothing of grave concern. I support moving it to the whole board.
Do you want, I mean, is it too early? My comment is, you know, if we're looking at that, I don't want the discussion at the committee of the whole to be what we had a year ago, where everybody kind of sat there and went, eh. I mean, are there recommendations as you look at this that, you know, we look at any type of program, or we look at
Well, I mean, I have questions about some things, but I think it's also more, I don't want to raise taxes, right? And I'm not saying anyone here does, but at the end of the day, it's going to be, I imagine it's going to be some sort of tax hike plus horse trade amongst the departments. And that's just honestly how I've envisioned it from the beginning. I think the purpose of the committees, going forward and recommending it to the whole board has been, if there is anything egregious off the bat, address it in committee before submitting it. It hasn't really happened, but
I would concur with that.
But there's going to be discussions, where the cuts come from, if any, if it's going to be all tax hikes, if there's going to be a meeting in the middle. Is it just supplementals we cut out? Is it some not essential but well-liked program? Is it, what is it? That I don't know. Yeah, of course. I know you can.
I can't, may be taking out. So how do you, for me personally, how do you envision that happening? I mean, information provided, no, I'm just,
cats.
for me, I don't do well, being very frank, I don't do well with somebody saying, make a decision. I need time to evaluate and to look at and to measure. So how do you anticipate, I'm not talking about you guys anymore, how do you anticipate moving forward in that budget process and having those discussions?
Well, I think it's going to come down to the people who don't want to raise taxes are going to look at everything, holistically. Not everyone, I'm fortunate enough to be on finance right now, so I see a lot of stuff, but not everyone is, right? And so they're going to be able to see the sheriff's budget, the state's attorney's budget, the elected official salary hikes. They're going to see all the department budget requests. They're going to see the revenues, the expenses, and at some point, everyone's going to have to make a decision. Are they voting to lower taxes and cut stuff, keep things flat and cut stuff, raise taxes and cut some stuff?
I understand above, but do you see that coming out of finance then? Kind of a recommendation from finance to have?
No, because there's 11 people who aren't on finance. I think it's going to be, excuse my language, it's going to be a shit show. It's going to be it's going to be chaos. Some people are going to want to cut from this department, some won't. I'm sure the departments, sorry guys, I'm sure the departments are going to be emphasizing like what they bring to the county and, to a certain extent competing with each other. But I think I have no problem advancing it to the board, but I do see there being a much larger conversation amongst 18 different personalities.
I have a question for Pete.
And cuts are, by the way, cuts have to happen no matter what.
Just because you
Even if
pretty
we
much
take them
attend
out.
all of the meetings, have all of the reviews that have come before the committees thus far pretty much had a general consensus to move them forward?
Yes, there was kind of
And that's where I think
With
Pam is,
some caveat on maybe look at this or maybe look at
Right,
that.
there
Like I'm
was a-
saying with the fee increases and stuff, but in general,
yes.
yeah. And that's what I'm trying to avoid. I don't want to have a shit show. I don't. I would like to have a conversation though that says.
I don't want it either.
I know, but we can structure it, I think, a little bit maybe differently with something coming out of finance with some, and that was the whole idea of recommendations on where to look, because I don't want to start all over again.
But what Mike recommends might not be what I recommend. Everyone's gonna have the differences, and at the end of the day, there's gonna have to be cuts somewhere, right? Even if we take the max
But
tax
aren't we
increase.
supposed to be sending some recommendations to you?
I'm waiting. Yeah.
I said so.
Yeah, no, a couple of committees have offered some opportunities, so.
I mean, do you foresee this going smoothly?
I was hoping it wouldn't be as like it was last year. That's what, that people have a better
It will
handle
be.
on where they can look or where they can't look. I mean, they're not gonna say, for example, let's take money from this fund and use it because they know we can't do that. So I'm hoping that doesn't happen.
It might be more structured.
Yeah,
Everyone
that's what
might be
I want, more
approaching it from
structured.
a more knowledgeable approach, but it's not gonna change the fact that are they still here? It's not going to be like everyone's, where the cuts come from. Someone theoretically is gonna be, let's take it all from public health. Someone else is gonna say it's the PD. Someone else is gonna say, no, let's hit the sheriff. Like, there's going to be that conversation. There has to be cuts, even if we take the max increase.
Okay.
And I just think when there's 7 people recommending, which like I said, for the most part, every presentation I've been a part of, I've been like, yeah, that makes sense. Which is why I know it's gonna be
So what I'm saying is if that's the case, then everybody better make a large block of time at the committee of the whole.
100%. It's gonna be a long
That's all I'm
time.
saying.
And I think if there's those sorts of suggestions that would come forth at the committee of the whole, they should start here. Because granted, there's 11 people that are not at this table, but all these presentations are available via agenda. We all know that as board members, we can show up to individual meetings and have our voice heard while we don't have a vote.
Watch them.
Yeah. And
I think they should certainly be prepared at the committee of the whole to talk about it.
Right.
Not just complain, but have ideas.
It will be more constructive if we get more ideas sooner than to try and respond at the committee of the whole. It's a real challenge.
And maybe to take a temperature again, if there's been any shift in any of the individual board members on the position that they held 2 months ago? 2 months ago. With regard to taking, to take nothing, to take -3, maybe we need to take a temperature again of where we feel there's a better consensus. And I just do this again, not only for our benefit, obviously, of having those conversations, but as staff too. I mean, how much time are we gonna ask them to go through all these different scenarios? I would prefer that we give them a better direction up front, somewhere in that.
No,
That's all.
That's fine, but you hear what I'm saying, right? Like, if we take the max increase, something still has to get cut. There's going to be, we
But a lot less.
can't all, for sure, but we
Right.
can't just, I just don't want there to be any impression that when I say yes, like, there was nothing egregious, that I personally had concerns about. But that doesn't mean there's not gonna be something brought up in the committee of the whole.
Understood.
And that's why I was really appreciative this year that staff worked so hard so we could get started on this early, frankly. But
I had that conversation with Terry, thank you, Sabrina.
My question to you, Pete, is we're gonna
advance this discussion in finance next week, in that committee of the whole the following week, and hopefully we're zeroing in. We're gonna have the big budget meeting, I believe, on the 25th of September.
And the final vote on it's November, right?
Final vote's November, but honestly, that finance committee in the second week or first week of October is where we will advance the budget for 30 days.
Oh, yeah.
That's where we're kind of done. I mean,
For sure.
There's not a lot that's gonna change, hopefully.
Well, but yes, I get what you're saying.
Yeah.
so for board members that have suggestions for cuts, when's kind of the soft?
Carrie and I are meeting this afternoon at 2 to start, again, trying to patch this together. But I, like I said, it's this Thursday, next Thursday is.
Yeah.
I need, if you've got ideas.
Yesterday.
If you have things that you think should be considered, please let us know.
Can we put a sort of call out to all board members that
They should show up to finance, honestly.
maybe just reminding them,
Or watch it.
as these are progressing,
Yeah, watch it for sure, but it would be even better, especially if someone feels strongly, they should show up to finance, if possible. Because again, we haven't taken a new temperature in the room, but I think the last temperature in the room was half was no increase or cuts. Okay, well, that's, as proposed, that's not happening.
It was a third. It wasn't half, it was a third.
I think it was flat,
Flat, you're right.
new growth
That was
and
it.
cuts were a majority. Well, that's not what has been presented through committees, so that's, I don't know. I know everyone has high hopes, but I predict shit shows.
So with that in mind,
Optimistic.
how are we, I mean, do we have a general consensus with what was presented today with the expectation of fee
I think I made that,
increases?
yeah, absolutely. Send it forward as it is with a recommendation to review fee increases and certainly come back with a new fee schedule, yeah.
Okay, thank you much. So, and thank you, Melissa, and everybody for being here and going through all of this. It is a lot of information, but with the new board members, I think it was really important that they fully understand, what the department does.
And I want to just, we didn't really spend any time on this sheet, but Melissa and the team put this together, and
Yes.
Kathy found a way to put it on 3 pieces of paper. It is a good resource if you're looking at consideration of the services provided by the health department, and if we don't do them, well, how are the services paid for, and if we don't do them, what's the ramifications?
Can we send that out to the full board? Maybe
Would
when
be
we do the
wonderful.
vote-only minutes that we send out, can we attach this document to that and just ask people to take a look at it?
And can I quantify that mandate is fairly clear, essential is eye
Not
translate?
mandated, but part of good public health practice for programs we've been doing, like the Illinois Breast and Cervical Cancer Program. It's meeting a need in the community.
Right.
Best practice.
Animal control, the state doesn't say we have to run an adoption center. It says you gotta dispose of animals, and you gotta hold them for 7 days to try and find the owner, or you gotta put them down, or, for 30 plus years, we've been running a low-kill adoption center. To change that.
I mean, you're retiring. You're gonna have some free time.
I would be a volunteer.
I'm thinking,
I'll be operating that dryer.
Join the board of
Maybe a
health.
clothesline. Okay, seeing no reports, any discussion under future topics? I think we need to be spending our time on budgets, so. Everyone's okay to move on, no executive session, is there a motion to adjourn?
Yes, I make a motion to adjourn.
Second.
Mr. Shorten seconds, all those in favor?
Aye.
Okay, thank you very much, everybody.
Thank you.
Thank you.